Happy birthday! Hi, I'm Lisa. I'm a Medicare specialist in the Health Division here at Dempsey Weiss & Associates. You may be wondering why we're talking to you about Medicare when you're only 63. Well, that's because Medicare has many requirements and deadlines. When you're eligible for Medicare, because you're turning 65, you're entitled to an open enrollment period. This is important so you can get everything in place before your Medicare becomes effective. The later in your open enrollment period that you delay taking any action could delay getting your Medicare coverage. Wait long enough and you could suffer penalties. This is why we're glad you're watching today. Let's back up and review some of the basics to Medicare. First, it comes from the federal government, or CMS, which is the Centers for Medicare and Medicaid Services. As you approach age 65, you'll start to get more and more mail and phone calls about your Medicare eligibility. It's important to pay close attention to anything that comes from CMS. Anything else is probably just solicitation. Medicare is broken down into 4 parts. Medicare Part A covers you if you're ever an inpatient in the hospital, and that comes from CMS. Part B also comes from CMS and covers you for certain things like doctor's appointments, x-rays, lab work, that sort of thing. When the time comes for you to apply for and then receive your Medicare ID card, these are the 2 parts you'll see on that ID card, Parts A and Part B. Because Medicare doesn't pay for all of these costs, they allow you to get a separate plan that may help pay for much of the balance. For our purposes, we'll consider this Part C. These plans are Medicare Supplement plans and Medicare Advantage plans. Both types of plans come from an insurance carrier, not CMS, an insurance carrier such as Aetna, Humana, or even Mutual of Omaha. Part D is the 4th and final piece. This covers your prescription coverage. Medicare does separate your prescription coverage from your medical coverage. That's why you'll need to get a Part D plan. Most people need to get both Parts A and B when they're eligible, but most people will need to get both Parts A and B when they're turning 65. Retirement plans, COBRA plans, spousal coverage, and even the size of your employer, if you're currently working, may affect which parts of Medicare you need to get and when. 2 years may sound like a far way off, but besides getting ready for your Medicare, you'll need to decide when would be best for you to collect Social Security in your circumstances. That is, if you're not collecting Social Security already. Also the time for you to confirm your retirement plans and the effect they'll have not just on your current and future finances, but also on your retirement and also on your Medicare. The good news is we help people with questions like this every day.